More than 90% of people have no idea that a simple mixture of water and baking soda can relieve pain, inflammation, and chronic fatigue in just a few days. It seems like just a drink. In reality, it's a powerful alkaline solution that can support health, balance acidity, and assist with dozens of issues. How many times have you had water, unaware that by adding just a pinch of baking soda, you could help your body recover? What if just one glass of water a day could impact your joints, digestion, and even blood pressure? In this video, we explore how water mixed with baking soda can help with 12 serious health issues that you might be facing right now, from heartburn to inflammation, from fatigue to infections. And it's all backed by scientific facts and step-by-step instructions. Make sure to watch until the end, especially if you're looking for a natural, affordable, and surprisingly effective way to support your health. The first problem that millions of people face is heartburn and acid reflux. It's not just discomfort. It's a burning sensation that rises up the esophagus, disrupts sleep, diminishes appetite, and drains energy. This is especially common after dinner when the body is trying to relax, but stomach acid rises. That's why water with baking soda can be a true lifesaver. Baking soda is a natural alkaline substance. When you dissolve it in water and drink it, it reacts with the acid in your stomach. This process neutralizes excess acid and helps relieve the burning sensation in just a few minutes. But it's not just about instant relief. Such a practice can help reduce the frequency of heartburn over time, especially if you maintain a regular eating schedule and avoid heavy meals at night. Researchers from the Journal of Gastroenterology note that baking soda in small doses effectively alleviates symptoms of acid reflux in elderly patients when used occasionally. This confirms that a simple remedy can be quite effective if used correctly. How should it be applied? Half a teaspoon of baking soda in a glass of warm water. Drink slowly, in small sips, preferably not right after a meal, but after 30-60 minutes. It's best not to do this more than 2 to 3 times a week to avoid disrupting your acid balance. An added benefit is that relief comes quickly, without the need for pills or side effects. Now let's move on to the second issue: gout. It's one of the most painful forms of arthritis. The pain comes on suddenly, often at night, affecting the big toe, ankle, or knee. The joint swells up, becomes hot and red, and even the slightest touch can cause excruciating pain. It all comes down to uric acid, which crystallizes in the joints. This is where a mixture of baking soda and water can play an unexpectedly important role. Why? Because gout is directly linked to the acidity levels in the body. The higher the acidity, the more uric acid crystals are formed. Baking soda, as a natural alkaline agent, helps shift this balance towards neutrality. When you drink a baking soda solution, it aids the body in eliminating excess uric acid, creating conditions under which the crystals dissolve more quickly and do not accumulate in the joints. Research shows that alkaline therapy reduces the intensity of pain attacks and decreases the frequency of flare-ups. This is especially important for older adults whose metabolism may already be slowed down, and the kidneys don't always manage to eliminate acidic waste efficiently. How should it be used? Dissolve half a teaspoon of baking soda in a glass of water and take it twice a week in the morning. However, be sure to monitor how you feel and consult your doctor, especially if you have kidney issues or blood pressure concerns. Additional bonus: when consumed in moderation, baking soda can help reduce inflammation and improve joint mobility, making it beneficial not only for gout, but also for other forms of arthritis. The third issue that millions of elderly people face daily is joint pain and chronic inflammation. Knees, hips, shoulders, movements become stiff, and every morning starts with a feeling of tightness in the body. Even a simple walk can turn into a challenge. Now imagine this. A simple and accessible solution like water with baking soda can help alleviate these sensations. How is that possible? The thing is, chronic inflammation is often linked to the acidity levels in the body. The higher the acidity, the more active the inflammatory processes become. Baking soda, as a natural alkaline component, helps balance pH levels and reduce internal inflammatory pressure. This alleviates stress on the joints, reduces swelling, and may even decrease the need for pain relievers. Research published in the Journal of Immunology indicates that the consumption of baking soda activates specific anti-inflammatory immune cells in the body, known as macrophages. This triggers a series of processes that assist the body in recovery. How to use it? Dissolve half a teaspoon of baking soda in a glass of warm water and take it 1 to 2 times a week. It's best to take it in the morning, before meals. Avoid daily use. Give your body a break and observe the results. An additional benefit of regular but moderate use is that overall stiffness decreases, joint mobility improves, and even morning stiffness is reduced. Now, imagine this scenario. You've slept through the night, but in the morning, you still feel tired. You barely have the energy for simple tasks, and by the afternoon, you just want to sleep. Sound familiar? This is the fourth problem that many people face: chronic fatigue and decreased energy levels. As we age, our bodies struggle more with internal acidification. This leads to metabolic disruptions, reduced oxygen saturation in cells, and decreased energy production in the mitochondria, the body's energy factories. Now, imagine that simple baking soda could help improve this process. When you drink water with baking soda, it helps restore your alkaline balance, which improves circulation, oxygen supply to the cells, and metabolism. As a result, the body starts functioning more efficiently, leading to increased energy. What's particularly important is that this effect isn't stimulating like caffeine. Rather, it's supportive. It doesn't force the body to wake up, but helps it operate correctly. Several studies have shown that consuming baking soda can reduce levels of lactic acid, which is responsible for muscle weakness and fatigue during exertion. This means that baking soda not only helps you wake up, but also improves your ability to handle physical activity. How should you use it? Dissolve a teaspoon of baking soda in a glass of water and drink it slowly on an empty stomach, 12 times a week. Don't overdo it. The benefits from this alkaline support will become apparent gradually. A nice bonus is clarity of mind, reduced sleepiness, and even an improved mood. Now let's move on to the fifth issue: heaviness in the stomach and poor digestion. This condition is familiar to many. You eat, and instead of feeling light, you have the sensation of a stone in your stomach, along with bloating, belching, and rumbling. This is particularly hard to endure in older age when digestive processes slow down. Here, simple baking soda dissolved in water can provide quick and noticeable relief. It acts as a mild antacid, neutralizing excess stomach acid and helping food to digest more easily. It's especially effective after overeating, consuming greasy foods, or having heavy dinners. So, how does it work? When you drink a baking soda solution, it reacts with the hydrochloric acid in your stomach. This reaction produces water, carbon dioxide, and regular table salt. This helps to reduce acidity and lessen irritation of the stomach lining. Gastroenterologists emphasize that for occasional digestive disturbances, Baking soda is an effective and safe remedy. It's important to use it no more than 23 times a week. How to use it? Mix half a teaspoon of baking soda in a glass of warm water and drink it slowly, ideally 30-60 minutes after a meal. An added benefit is a reduction in gas, along with a feeling of relief and lightness in the body within 15-20 minutes after consumption. Now, let's discuss the sixth issue: increased acidity in the body, often referred to as acidosis. This condition may not show clear symptoms for a long time, but over time, it can lead to chronic fatigue, inflammation, joint pain, a weakened immune system, and accelerated cellular aging. As we age, the body's ability to maintain acid-base balance decreases. We consume acid-forming foods, experience stress, and engage in little physical activity, all of which shift our internal environment toward acidity. As we know, acid breaks down tissues, suppresses enzymes, and disrupts metabolic processes. This is where alkaline water combined with baking soda becomes a true ally. When you drink this solution, it helps neutralize excess acids, restoring the natural pH, especially in your blood, lymph, and interstitial fluid. Experts emphasize that maintaining a slightly alkaline environment with a pH of around 7.4 is crucial for the health of your blood vessels, kidneys, joints, and even cognitive functions. Regular alkaline support can help reduce the risks of inflammation and age-related metabolic disorders. How should it be used? Start small. Mix a teaspoon of baking soda in a glass of water once every 3 to 4 days. This is enough to gently help maintain balance. If you consume acidic-forming foods a bit more often, it's fine, but don't go overboard. Too much alkalinity can be just as harmful as too much acidity. Another benefit is an overall feeling of cleanliness and lightness, as well as even normalization of intestinal function. The seventh issue worth discussing is urinary tract infections, commonly referred to as UTIs. They are particularly common among older women. Burning sensation during urination, frequent urges, and heaviness in the lower abdomen can significantly reduce quality of life and cause ongoing discomfort. In such situations, water with baking soda can provide a gentle yet effective relief. Why is this? The issue is that during an infection, urine becomes too acidic, which intensifies pain and irritation. When baking soda enters the body, it makes the urine more alkaline, reducing acidity and helping to alleviate burning sensations. An alkaline environment also slows down the reproduction of harmful bacteria, making it easier for antibiotics to work or allowing the body to handle the inflammation on its own in mild cases. Research shows that adjusting the pH of urine can speed up recovery and reduce the severity of symptoms within just 12 days of use. How to use it? Dissolve a teaspoon of baking soda in a glass of water and drink it once a day for no more than 3 consecutive days. This is not a substitute for treatment, but it may provide additional relief during the early symptoms or in conjunction with standard therapy. Another benefit is the reduction of urges, decreased discomfort, and a faster recovery compared to going without support. The eighth issue, which is less frequently discussed but particularly important as we age, is the weakening of the immune system. Frequent colds, prolonged recovery after illness, and unexplained fatigue can all be signs that your body's defenses are depleted. This is where a simple remedy like water with baking soda might surprisingly come in handy. After all, immunity isn't just about the cells that fight off viruses. It's a whole system, and its effectiveness depends on the balance of the environment in which it operates. One of the key factors is the body's pH level. When the body is acidic, immune cells function more slowly, inflammation becomes chronic, and pathogens multiply more actively. Alkaline water helps to change this internal environment, improving the conditions for the immune system to operate. Research shows that moderate alkalization of the body activates phagocytes, cells that engulf viruses and bacteria, and reduces the levels of inflammatory markers in the blood. How to use it? Start with a teaspoon of baking soda in a glass of water 12 times a week. Drink it on an empty stomach or between meals. Just make sure not to do it every day, so you don't disrupt your natural balance. Bonus: with regular use, many people experience a decrease in the frequency of respiratory infections, improved resilience to weather changes, and a quicker recovery from colds. The ninth issue that many elderly individuals face is high blood pressure and deteriorating blood vessel function. It's especially unpleasant to wake up in the morning feeling heaviness in your head, throbbing in your temples, or experiencing dizziness. Often, this isn't just a result of aging, but rather a consequence of blood vessels losing their elasticity and being in a constant state of spasm. It turns out that a mixture of baking soda and water can have a gentle supportive effect in this regard. Research shows that when restoring the acid-base balance, the body can more easily regulate vascular tone. An alkaline environment promotes the relaxation of smooth muscle in blood vessels, which means that blood pressure can decrease naturally without sharp spikes. Additionally, baking soda helps reduce inflammation in the endothelium, the inner lining of blood vessels. This is important because chronic inflammation causes blood vessels to become stiff, increases the risk of blood clots, and hinders smooth blood flow. Of course, baking soda is not a remedy for hypertension. However, when used moderately as a supplementary aid, it may improve overall well-being, reduce tension in the body, and help normalize sleep for individuals suffering from nighttime hypertension. How to use it? 1 teaspoon of baking soda in a glass of water once every 3 to 4 days, preferably in the morning. Do not combine with blood pressure medications, and be sure to monitor your condition. An additional benefit includes improved circulation, reduced swelling, and decreased feelings of heaviness in your head. Now, let's discuss the 10th issue: dry cough and sore throat. Especially during transitional seasons, after exposure to cold air, or when you have a cold, these symptoms can persist for weeks. For older adults, even a mild tickle in the throat can develop into a chronic cough and lead to fatigue. That's why using baking soda in water, or even just as a mouthwash, can be very helpful. It has a gentle antiseptic, anti-inflammatory, and soothing effect. Baking soda reduces irritation of the mucous membranes, lessens discomfort, and makes it easier to cough up mucus. When you use warm water with baking soda for rinsing, it helps flush out microbes, reduce acidity in the throat, and create a favorable environment for recovery. This is especially effective in the first few days after symptoms appear. If you drink water with baking soda in small sips, it can also help soothe a dry cough, especially at night, and alleviate discomfort while swallowing. How to use it? Dissolve half a teaspoon of baking soda in a glass of warm water and gargle with it 3 to 4 times a day. If you're experiencing severe dryness in your throat, take a sip every couple of hours in between meals. An added benefit is that baking soda can neutralize the acidic environment that contributes to inflammation in cases of gastroesophageal reflux, which often accompanies nighttime coughing. Now, let's move on to the 11th issue: oral health and gum disease. As we age, our mucous membranes become thinner, our teeth become more sensitive, and our gums are more prone to inflammation. Add dry mouth, dentures, or crowns into the mix, and you create the perfect environment for bacteria to thrive and for bad breath to develop. However, there is a simple and accessible solution that can help maintain oral health without harsh chemicals: regular baking soda. Its alkaline nature helps neutralize the acids that erode enamel and irritate the gums. The antiseptic effect of baking soda reduces the number of harmful bacteria. Regularly using baking soda for rinsing can improve overall gum health, decrease bleeding, freshen breath, and even lower the risk of cavities. This is especially beneficial for older adults who may have reduced saliva production, which disrupts the natural protective mechanism of the mouth. How should it be used? Dissolve a teaspoon of baking soda in a glass of warm water and rinse your mouth 12 times a day. You can also add a pinch of baking soda to your toothpaste once a week while brushing. This will gently remove plaque and freshen your breath. An added benefit is that baking soda doesn't contain alcohol like most mouthwashes, so it won't dry out your mucous membranes or cause irritation. The 12th and final issue we'll discuss is a slow metabolism and ineffective detoxification of the body. As we age, our metabolism becomes less active. Food is digested more slowly, toxins are eliminated less effectively, and we may experience bloating, fatigue, and weight gain. All of this indicates that our bodies need assistance, gentle yet consistent. And once again, simple baking soda and water come into play. Why? This is because alkalizing the body's internal environment makes it easier for the liver and kidneys, our two main filters, to function. When acidity levels drop, enzymes become more active, and detoxification processes work more efficiently. Additionally, alkaline water may help improve gut function, reduce inflammation, and accelerate metabolic reactions. This translates to more energy, less stagnation, and better absorption of nutrients. Research shows that with gentle, controlled alkalization, the body can eliminate waste products more efficiently, leading to a more stable overall well-being. This is especially important for those with a sedentary lifestyle, where natural detoxification processes are slowed down. How to use it? Mix 1 teaspoon of baking soda into a glass of water and drink it once every 45 days, preferably in the morning on an empty stomach. This will create a mild detox effect without overloading the kidneys or disrupting the balance. An additional bonus is reduced inflammation, improved skin tone, a feeling of lightness in the body, and even a better mood. As you now know, a simple mixture of baking soda and water is not just a folk remedy. This scientifically backed solution can gently yet noticeably support your health, especially as you age. Heartburn, gout, inflammation, fatigue, infections, high blood pressure, cough, and digestive issues, all of these can become more manageable if you incorporate baking soda into your routine wisely and in moderation. It's important to remember that baking soda is not a medicine and should not replace therapy. It's a supportive tool. Always start with small doses, closely monitor your body's reactions, and consult with a doctor, especially if you have chronic conditions. Have you ever tried drinking water with baking soda? What effect have you noticed? Share your experience in the comments. It could help others. If you found this video helpful, please give it a thumbs up, subscribe to the channel, and share it with anyone who might benefit from it. A simple action can make a big difference.